It's almost good afternoon and it's Wednesday. I'm sorry, it's Thursday. I can't be there today, but I did want you to have this recording so that you know what to study for exam 2. That's going to be next Wednesday, the 14th of July. It's going to be 50 questions and you're going to have 100 minutes, okay? Now, it is going to be based on chapters 36, 37, basically antihistamines. So I think it's 36 and 37. Let me just check for you. But also chapters 56, 57, and 58. So once again, it's chapters 36, which is antihistamines, 37, which is respiratory, and then 56, 57, and 58. So derm, eyes, and ears, okay? So those are the chapters that are involved. Now, let's just talk a little bit about some of these questions. Antihistamines, the side effects of antihistamines you need to know. You need to know things like guaifenesin, what is it for and what's the patient teaching? Definitely you need to know about echinacea. It's a herb, and I'd like you to know what the patient teaching is for that. What are they using it for? Because lots of people use over-the-counter herbs, remember, for different things. Antihistamines, again, patient teaching. When should they take them? How is it going to affect them? All of those types of things. All right. I'd like you to know about COPD, chronic obstructive pulmonary disease, and what can be taken for that. For instance, IV aminophylline might need to be given. What is that? And what is it going to do? How is it going to help the patient? What's the outcome that we're looking for? Again, along those same lines, an xanthin derivative, which is part and parcel of that. Remember, I think I told you aminophylline downstreams to caffeine. And so that can be used for COPD, okay? So again, you need to know what it's for and what the side effects are. Common side effects, okay? Asthma, what medication gets used for the initial treatment? It's either an inhaler or a nebulizer, but it's the initial treatment that gets used for it. It's a SABA, remember, a SABA. And then on top of that, what you also need to know is what comes first. Does a SABA come first and then an inhaled corticosteroid? You need to know that as well. You need to know the procedure, okay? Which inhaler comes first? The other thing you need to know is leukotriene receptor antagonists. What are they used for asthma for? Is it for an acute situation, more of a preventative, long-term type of continuous schedule type of treatment? Okay. Nebulizers like SABAs, what are the side effects? What are the side effects of those? Just to think about it, some of them, like palpitations, could be a side effect, okay? Anxious, anxiety, nervousness, tremors. Steroids, inhaled corticosteroids. What do we tell them that they have to do after they've taken their inhaler to prevent fungal infections? So remember that. Candidiasis, dry mouth. You need to know about that. Okay. Let's see. Yeah, patient teaching regarding the inhaled corticosteroids is another piece of it that you need to know. Teaching, teaching, teaching. A lot of this is teaching. Know the theophylline levels. We talked about that in class. Remember, anything that has a level that needs drawing usually indicates that the dose could be toxic or not therapeutic, right? So what is the issue there? Metered dose inhalers. Remember that there's other ways of helping that patient use the metered dose inhalers. So what would be some of those therapeutic pieces that could be used to help the patient get the inhaled medication in them? What intervention would be used? Okay, let's look at some of these others for you. Know the difference between a SABA and a LABA and what they're called. The SABA are the short-acting beta agonists like albuterol, and those are for more of an acute situation, or PRN, as needed, whereas you have some others, salmeterol and fluticasone, that are a combination that are used more for preventative, right? To prevent bronchospasm. So bear those in mind. Know what that is. Again, asthma. We're talking a lot about asthma. So know the different medications for asthma. Okay. Let's see. All right. Retin A. Remember, there's a difference between tritonin and isotritonin, big difference. But understand what you're going to teach if somebody is taking Retin A. What could it cause the skin to do? Does the patient need to stay out of the sun? All of those types of things, all right? Skin prep. Betadine. Make sure you're talking to the patient about allergies. What type of allergies could be an issue with betadine? Impetigo is a skin disorder, usually with children. We talked about a few different antibacterial medications, skin medications, so I would suggest you learn those skin medications. And I also talked about Silvadene. What is Silvadene used for? I also mentioned to you about candidiasis or fungal infections. I want you to know about what you would do about those fungal infections, the skin fungal infections, okay? What is that? Candidiasis is a fungal infection. Okay. Let's see. Remember some lab values. And we talked about this a little bit when we talked about coagulation. So I need you to know your coagulation lab values, certainly your PT and INR. And remember, I talked about a certain wound debridement medication that you need to know. So I would remind you of that. Teaching points for the oral isotretinoin. Big teaching points about that. Remember what that type of medication is. Remember, it is pregnancy category X. So what is the patient teaching related to that? All right, MRSA. Remember, if somebody has been colonized for MRSA, what are you going to do about it? What medication is going to be used and where? Again, Silvadene. What type of patient would not be a candidate for Silvadene? Remember your allergies. Okay. Topical sulfadiazine. There's your big clue. Expect you guys to do really well on this. Again, adverse effects with Retin-A. You need to know what those adverse effects are, please. And isotretinoin, which is not Retin-A, but it looks very similar. Again, patient teaching, understanding the side effects of this medication. Glaucoma. We talked quite a lot about glaucoma. Now, one of the meds that I may not have mentioned to you, but it actually is a glaucoma med, is mannitol, Mannitol. So I'd like you to look that one up, please. Glaucoma, anti-glaucoma drops. Remember I talked about a medication that can change the eye color. Which one is that? You need to know it. Patient teaching. Also patient teaching about eye drops. Remember in that patient teaching section where it told you exactly how to do it? How you apply the eye drops and where. Okay? So you need to know that. Read up about it, please. Eardrops. When would you not put an eardrop in the ear? And when would there be a combination of an antibiotic eardrop and a steroid eardrop? Why would you use both of those? What do they do? Earwax emulsifiers, what would that do? And what is the contraindication of that? Know what a meiotic is. What are we using meiotics for? M-I-O-T-I-C, meiotics. We talked about meiotics and mydriatics. Okay, the proper administration of eardrops, know that. Know how to give eardrops, all about your eardrops, how to give them, how to administer them. And then nasal sprays. Know about the teaching of nasal sprays. What are they for? How do they help? And how long should you give them? Remember, we talked about that too. Let's see what else I have for you. Remember that these sprays, these decongestants, can have what's called an adrenergic effect. So if it's an adrenergic effect, what type of effect is it going to have? It can speed up the heart rate, right? Those types of things, headaches, dizziness, nervousness, palpitations, high blood pressure. So all of that is patient teaching. Know what you would use, rather, for a patient that has some thick secretions, thick mucus secretions. What would you use? And how long would you use a nasal spray for? Remember, I asked you to know about cough suppressants, and I need you to know the pathophysiology behind them. Okay, which one does what? There's two different ways of suppressing the cough. So know which is which. Okay. Cholinergic blocking eye drops. What is the correct term? Is it mydriasis or meiosis? You need to know the difference, please. Especially if someone's having eye surgery, you need to know What is it going to do? Okay, let's see a couple of other things for you. Okay. We did talk about beta 1 and beta 2. I'd like you to remember inotropic, dromotropic, and chromotropic. It didn't just come up with cardiac, it came up prior to that. So I need you to know those terms and the difference between negative and positive. Okay. And again, we talked about beta blockers. I have included a couple actually to do with beta blockers in here because we talked about beta blockers a little bit in those topics. And of course, we talked about it this week too. So I have included, I'm giving you a heads up, a question about a beta blocker, all right? So you need to know about a beta blocker. It's a question that I'm keeping in this exam. So hopefully you're listening to this recording. So it's about a beta blocker and how do you monitor that? What are you going to do before you give a beta blocker? What does the pulse have to be? Okay. Know a term, xerostoma. What is that? Xerostoma. And what would we give to help with that? Ginseng. What is the side effect or adverse effect of ginseng? And the dosage calc is very simple. There is going to be an intake and output question on it, but it's a pretty simple dosage calc questions. Very simple, in fact. So I expect all of you to do really, really well on this exam. There's absolutely no excuses. I've pretty much gone over everything for you. Your job is to listen well to this recording and use the information that you've been given. I will put an announcement and I will give you some of the meds as well. Okay? Have a good afternoon. Listen to this recording. Thank you. Bye-bye.